about it a lot. Know your numbers, but so many people don't know their numbers. So we're going to bring in Phyllis Ellis here. You know her from the health department, but also a board member for the American Heart Association. And I think that's exactly what we want to get right to is how do we know we're doing okay?
You're absolutely correct. You should know your numbers, and what that means is really meet with your healthcare provider, get your first baseline test, or for instance, test here. Know what your numbers are so you can determine how they are in relation to your high risk factors or your family history, what they should be for your age, your height, your weight, and get a plan together. So, what your numbers are showing might require you to have a diet plan, have a different way of eating, increase your exercise, and once you know your first baseline numbers, then you can determine if you're doing better, are they going down. Do you have high risk factors in your family? You might need to be on some medication, even though you're doing what you should be doing with meds, with diet, you might still need your meds. But talking about numbers, you're looking at your blood pressure. They've decreased the numbers now to 120/80 as a normal blood pressure. So those of you that were up a little higher than that might want to sit down with your provider and talk about, what should you do to try to bring it down.
Some people have a mindset of, I feel fine, I don't need to see a doctor. It's important, though, to maybe get that baseline with your doctor, to have that open communication, isn't it? How do you talk to those people and, get them to come to the doctor, even if they don't feel well, just to get that analysis?
You should have an annual exam, even if you're healthy, and these are the kind of things that will come out. And the scary part about heart disease or stroke or diabetes, which could lead to heart disease and stroke, is that there's no really warning signs of heart disease until it happens. And you might have a heart attack, and you say, I feel fine, and all of a sudden something happened. Your cholesterol might be high, you might have plaque that's causing you to have this heart attack, but if you saw those numbers and your physician was working with you, you could avoid the risk of having a heart attack or stroke or worse.
Statistics still the number 1 and number 5 killer. I do remember us starting this together, and we were saying number 1 and number 3. So, is that progress?
Yeah, I guess it's a good thing. I think part of it is that when you know your numbers and when you are working with your provider, you can prevent death, obviously, so it's not the killer that it was. You might still have the cardiac history, your family history, but you're, working within it and you're monitoring it and you're avoiding something that's fatal.
Phyllis, thanks for coming on the program. We really appreciate it.
We have your full forecast next.